perform this procedure, you will need the following supplies: disposable gloves and appropriate attire, syringes. A 5 ml syringe is commonly used. However, if larger volumes of blood are required for testing, you can use up to a 20 ml syringe. Sterile needles. Needle size will vary from 21 to 23 gauge, depending on the size of the duck and the volume of blood required. It's best to use 23 gauge needles in young ducklings. Cotton or gauze, 70% alcohol, blood collection tubes, and a waterproof marker or pen. Pen the ducks using trap gates. Make sure that there is enough room for them to move freely, but not enough room to injure themselves if the flock panics. Catch the duck by the wings and restrain it. It's easiest to have an assistant help restrain the duck while you draw the blood sample. Position the duck on its back on a flat surface. Bleeding tables, such as the one used here, are a useful way to safely and quickly immobilize ducks for blood collection. Position the duck on its back and secure the band across its body. The best location to collect blood in ducks is the saphenous vein, located near the hock joint. Grasp the foot firmly in your non-dominant hand. Swab the medial leg region between the hock and foot with a disinfectant solution and identify the vein just proximal to the dew claw. Pull back on the plunger to break the seal in the syringe. This will help prevent the vein from collapsing during the blood draw. Rotate the needle so that the bevel is facing up. Gently insert the needle directly over the vein, parallel to the vessel. The needle should be about 10 to 20 degrees off the surface of the skin. Insert the needle approximately 0.5 centimeters until you see a flashback of blood appear in the hub of the needle. If necessary, slowly reposition the tip of the needle until it penetrates the vein. Gently pull back on the plunger and slowly fill the syringe with blood. The maximum amount of blood that you can obtain from an adult duck is 10 milliliters. Avoid excess suction, as this can collapse the vein and produce a hematoma. If blood stops flowing, rotate the needle to move the beveled opening off the vessel wall. Once you have collected the sample, withdraw the needle and place a disinfectant swab over the puncture site. Apply gentle pressure until clotting occurs. In some cases, elevating the leg may help slow bleeding. Remove the needle from the syringe and transfer the blood to a blood collection tube or snap cap. Mark the tube with relevant information, such as animal number, farm name, flock number, and date. Lastly, make certain that you dispose of the needle and syringe properly.